Welcome again, this time into Wellness Central, our little segment here for health. Now, January is Cervical Cancer Awareness Month, a time dedicated to raising awareness about cervical cancer, its prevention and the importance of early detection. Cervical cancer remains one of the leading causes of cancer-related deaths among women worldwide. But with regular screening and vaccinations, it is largely preventable, they say.
And so today we're honored to have with us Dr. Tewa Onasanya. She's the founder, she's the founder, Exquisite Magazine Cancer Care Foundation, which is an organization committed to supporting cancer patients and promoting cancer awareness. Dr. Onasanya, thank you for joining us, and good morning to you.
Thank you. Thank you for having me. Happy New Year.
Happy New Year.
Thank you.
I mean, doctor, let's just start. You know, as we observe Cervical Cancer Awareness Month, could you share with our viewers the significance of this observance and why it's crucial for women's health?
Right, thank you very much. So January is Cervical Cancer Awareness Month, and a lot of people don't know this, and a lot of people are not even aware about cervical cancer, what it is, how it can be prevented, why screening is important, which is why every year, January and all through the month, we're always talking about cervical cancer. Cervical cancer kills 1 woman every hour in Nigeria. This is from the stats record from the WHO, and cervical cancer is one of the few cancers that is 100% preventable. But people don't know this, and people are not aware that getting screened is important to preventing cervical cancer. The reason we say it's 100% preventable is because it's also one of the few cancers that presents a precancerous stage before it becomes full-blown cancer. Now, I'm sure, like I was watching News Central this week, and there was a survey done, and some women on the streets said they didn't know about cervical cancer. This is what we're going through in Nigeria, and in parts of the world as well. A lot of people don't know about cervical cancer. Yes, they know about breast cancer, but cervical cancer awareness is very, very low. This is why we're championing the cause, making sure that every year and as often as we can, we're telling people about cervical cancer, how to prevent it, and the importance of getting screened and vaccinated.
Well, that's very interesting. About the cervical cancer, you just noticed some very interesting bits here. It is 100% preventable. It presents before it becomes cancer. I also always hear of the human papilloma virus each time I hear about these screenings and the vaccinations. So what's the relationship between cancer and HPV?
Right, so HPV, as you rightly said, is human papilloma virus. And guess what? This virus lives harmlessly on men. But when certain strains of this virus gets into the woman, then, it could start getting the cells to replicate at an abnormal rate in the cervix, which could eventually become cervical cancer. Now, I said 100% preventable because once regular screening is being done, these abnormal cells that are probably growing can be caught early, and then it can be treated before it becomes full-blown cancer. Now, cervical cancer is so, I want to use the word so nice to women because, and the reason I say that is because before it becomes cancer, it introduces itself with the abnormal cells. So when women are getting screened regularly, this can be caught and then they can be treated. And then another big thing, which is, another big reason I say that it's nice to women is because there are HPV vaccines as well that can prevent cervical cancer. So we're championing and, letting people know about these different things that could eventually save their lives. Women, children, people who are sexually active, even the young children that are not sexually active yet, getting vaccinated. This will prevent cancer, HPV-related cancer from occurring in their lives. So it is, that is the relationship between HPV and cervical cancer. And there are HPV testings that can be done as well to check the level of HPV in the woman so that to prevent cervical cancer in future.
So when does it become impossible to treat, or when does it become, cancer? When is there?
Right.
What's the point of no return for the HPV
The
virus?
point of no return.
Yeah.
So I won't say it's the point of no return, even though when it becomes cancer, I mean, it is the point of no return to an extent. But another nice thing about cervical cancer is it has an incubation period of about 10 years, which is why that screening is, is important to be done regularly. So from a time the abnormal cells start growing to about 5 to 10, let me say 5 to 10 years later, it doesn't become cancer until 5 to 10 years later, which is why if screening had been done, it would have been noticed and it would have been caught and then treated. Now, 5 to 10 years later is when it now becomes cancer. That is when we're now talking about, treatments that now become expensive and invasive as well. We're talking, chemotherapy, we're talking colonoscopy, we're talking, other different things that are now expensive to treat. Do you understand what I'm saying? And
yes,
at that point, that is when women now start seeing symptoms. Because during the pre-stages, there are no symptoms. But when it now becomes cancer, that is when women start seeing different symptoms in their bodies, symptoms like abnormal discharge during periods, symptoms like, maybe pain during sexual intercourse, and things like that.
And let's talk about, screening, right? Because as always, early detection is the best route to go. What are the recommended screening methods for cervical cancer, and how often should women undergo these screenings?
Right. The most popular ones are the pap smear and cytology. So pap smear and cytology. So if a woman does a pap smear test, that is meant to be done every 3 years. So every 3 years, you go to your healthcare professional to get screened using the pap smear one. The cytology can be done every 5 years because that one is a little bit more intense, so to speak, and that can be done every 5 years. Now there's another one which is used for mass screening, which is what we do at the Exquisite Magazine Cervical Cancer Prevention Foundation, which is a method using the VIA method, and VIA is visual inspection using acetic acid. Now with this method, screening is meant to be done every year, and the reason we use this method is because it's cheaper. And we say to people, if you can't afford to do the pap smear, at least do the VIA that you can do every year, so at least you know what the status is. And with the VIA, which is, like I said earlier, visual inspection using the acetic acid, once the acetic acid is put into the vagina, I don't know if I can say that on air, but into the female private part, when there's a discoloration, that's when they know if there are potential abnormal cells growing. Now if that is seen, then they can be referred to for further tests. Even the pap smear as well, once that is done, that is, every of the tests involves going in to the woman to collect samples. And some people might find it, a lot of people might find it a bit painful or a bit invasive. But then again, it's 5 minutes of discomfort to check if anything is growing, and to have that, to have that screening done to prevent anything further happening.
Right. I mean, Dr. Onasanya, you are the founder of Exquisite Magazine Cancer Care Foundation, and that means that you have come across a number of women and men who have misconceptions about, cervical cancer, about the screening, about, HPV. And so I have to ask you, what are some of the most bizarre misconceptions you've heard, in just, caring for cancer patients and raising awareness about cervical cancer?
We've heard different stories, it's unbelievable, different misconceptions. Some women actually don't even know that they have cervix. Would you believe that?
Oh, wow.
That is why awareness is key, because we've done a survey in different parts of Lagos and different parts of Nigeria where people are saying, what is a cervix? Or do women have a cervix? And some men are quite knowledgeable. Some, very small percentage of men are quite knowledgeable, but a lot of people are not. And then some people can come to you and say, oh, cervical cancer, I thought you can only get it because you smoke a lot. And I'm like, no. Yes, it could be one of the reasons, but it's not the only reason. And because they're smokers doesn't mean they're gonna get it. Another one is What's another one? Okay, another one is the pain thing. A lot of women think that the few women, not a lot, but the women that know about cervical cancer think that the screening is very, very painful. And I'm like, no, I mean, if you're going to, when you're going for the screening, yes, they'll explain a little bit to you. And then, yes, you know, the curriculum is going into you anyway, but then again it's 5 minutes of discomfort. But the big one is the fact that a lot of people don't know that it could be sexually that it's via sex as well, because a lot of people can say that, oh, you know, it can be prevented using condoms or, you know, things like that. Yes, condoms are, you know, great protection, but then again, HPVs can spread in any way, so they're not great prevention. Another misconception is people saying, oh, I'm a virgin, I've never had sex before, so I can't have cervical cancer. Yes, that is true, but then again, you could have been in contact with HPV somehow, so you do need, especially when you're, you know, in your 20s, I'd say, you know, maybe 25 upwards, you do need to at least get yourself HPV tested. So those are some of the misconceptions that we've come across.
Let me take you back to two responses back where you talked about the fact that you have to repeatedly go for these screenings.
Yes.
Why must you go repeatedly? Isn't one time good enough? Especially perhaps maybe if one is being celibate. Wouldn't one time be just okay?
So one time is not enough, because remember I said that it has an incubation period of almost 10 years. Yeah. So let's say, you know, a woman is, you know, sexually active just once in her life, yeah, and then unfortunately comes in contact with a man that has a strain of HPV that would affect her. If she goes in the first year and, you know, the cells are great, nothing's happening, remember it has an incubation period of almost 10 years. So within those 10 years, anything can happen. That's why it's advised that you go every 3 years or every 5 years or every year, depending on which test you do. That incubation period is a critical one, because it might be caught early or it might be caught later. So it's important for the screening to be done regularly. And really and truly, the age that we advise people that you can eventually stop screening, I think is probably in your 60s. Then we can say, oh, you know, you don't really need to go every 3 years anymore. But if you're as a sexually active woman, even if you've only had sex once, every 3 years or 5 years or 1 year, depending on the test you do, is crucial because of that incubation period.
And I remember my foray into the mall one day. There were people who were there talking about HPV and also talking about cervical cancer, but most importantly, trying to, you know, get people to sign on to get vaccines. And while standing there and just watching them and, you know, paying attention to them as they're trying to canvass for, you know, for people to come on and sign up for this, a lot of people turned down signing up because they realized they had to pay for the vaccines. And so let's talk about this, you know, in our cost of living crisis that we find ourselves in this climate, health always seems to take the back burner, you know. Yeah. So let's talk about, you know, just how important it is for this HPV vaccines, and, you know, and also most importantly for, you know, private sector and, you know, public sector to come together to sort of subsidize the price of the vaccine so that more women can have the vaccines.
Yeah. Thank you for that question. Now, you are right. You know, in economic crisis, health does take the back seat. I mean, we've been to rural areas to go and screen people for free, and they're like, you know, instead of screening us, why don't you just give us the money? We'd rather buy food and things like that. This is something that, you know, needs to be talked about a lot as well, because, you know, if you're healthy, then you'd be able to go out there and do more to sustain yourself financially, so to speak. And yes, it would be nice if the vaccines are free. It would be nice if they're subsidized as well. A lot of organizations are working on getting these vaccines subsidized. I know that the federal government, I think last year, did a lot of vaccination in some states in Nigeria, free actually, for the children. Just so, you know, on this journey of reducing the deaths of cervical cancer. So I suppose more still needs to be done, but organizations, even like ours as well, with the Exquisite Cancer Care Foundation, sometimes we're able to raise money to screen, sometimes you're able to raise money to not only screen people, but to also provide vaccination. In the past, we've done about almost 100 free vaccinations for children in different parts of Lagos. So it is important for it to be subsidized because they are quite expensive, and a child needs 2 shots, and adults need 3 shots of these vaccines over a period of time. So I mean, the prayer is for organizations to be supported enough to be able to do this free screening, to do this free vaccination, even free screening as well, because you have to still pay for the screening. It's not complete. It's not free in Nigeria, unlike other parts of the world where you know, like in England, for instance, screening is free. As long as you're from 21 and above, screening is free. So it's still not free in Nigeria, but it's something that we're canvassing for, and it's something that we're working with, so to speak, to make sure that at least screening is free, and then vaccination is subsidized. And I have to say something about vaccination as well, because a lot of people forget this. Some people, which is a misconception actually, some women think, sexually active women think that when they've been vaccinated with the HPV virus, they don't need to get screened again. But this is untrue. You still need to get screened because you have been, because of that incubation period that I talked about earlier.
Okay. How does one, female, reduce risks? Save vaccinations or regular screening? What habits could be taken to reduce risk of getting the HPV and further cancer?
Right. Habits include limiting the number of sexual partners you have. The reason we say this is because, remember I said earlier that different strains of the HPV live harmlessly in men. So limiting the number of sexual partners you have, definitely getting screened regularly, getting the HPV vaccine. Smoking is a contraindication as well. So, you know, we advise that people either stop smoking or reduce their smoking intake, and basically just taking care of yourselves and your the immune system, because when the immune system is compromised, the possibility of cancers developing is higher.
I mean, Doctor, I must say thank you so much for just taking out the time to just join us for this conversation. It's been one that is very important and needed and timely, and when it comes to women's health as well. I mean, I always say that medicine and science have not done us a favor when it comes to reproductive health, and and so much more for women. And well done for all the work you've been doing with Exquisite Magazine, Cancer Foundation. Once again, thank you.
Thank you so much.
Now, before we wrap up this conversation, our reporter, our correspondent, Bettina Unweli, has a small report on cervical cancer awareness for this month. Take a look.
The HPV virus that causes cervical cancer lives harmless in men. It's only when a certain strain gets into women that it becomes cervical cancer.
The month of January is the Cervical Cancer Awareness Month, serving as a reminder for women to take proactive steps towards their health. According to the World Health Organization, cervical cancer is the 4th most common cancer in women globally, but with early detection, it is highly treatable.
I'm not aware about cervical cancer.
No, I don't know about it. I hear about it, but I don't know about it.
I've heard about cervical cancer, but I don't really know much about it. But I know it's prone to women, and it's the cancer of the cervix. I know about the human papilloma virus, and I know about its vaccine. I have been vaccinated.
According to the Information Center on HPV and Cancer, approximately 12,075 women are diagnosed with cervical cancer each year in Nigeria, with about 7,968 succumbing to the disease, making it the 2nd most frequent cancer among Nigerian women and the 2nd leading cause of cancer deaths among women aged 15 to 44.
Cervical cancer is one of the cancers that presents no symptoms until it has become cancer. That is why we're, ringing on the bells, knocking on doors, letting people know that cervical cancer is preventable. And the reason it's preventable is because before it becomes cancer, we can catch it early when the precancerous cells are growing. So women won't know that they have cervical cancer until it has gotten to the bad stage.
In 2020, the latest year for which data is available, Nigeria recorded 12,000 new cases and 8,000 deaths from cervical cancer.
If people are not aware of anything that's happening, then they will be ignorant and deaths will be occurring. Cervical cancer is 100% preventable. So if you're a woman that is sexually active, ask your doctor about, doing the smear test. Ask your doctor about cervical cancer prevention. If you have children or girls especially, from the ages of 9, get them vaccinated. When you get children vaccinated at that age, you're preventing one case of cancer being prevented for the rest of their lives. Another thing is for women to go and get HPV tested. Let's know your status. Know, if there's HPV in your system and things like that. It's important to raise that awareness.
The month of January isn't just about resolutions. Schedule your screening, talk to your healthcare provider about the HPV vaccine, and share this knowledge with all and sundry in order to make a difference by spreading awareness and encouraging preventive care in Nigeria. In Lagos, for News Central, I am Bettina Unwili.